You can't complain about research or anything that's done if you're not involved in it.
The reason I involved in mental health research because myself is a researcher and also my background as an international student from China. So when I left China, we didn't talk much about mental health. We still have stigma in mental health. My PhD and my lived experience taught me that it's so important to be involved, the public who have lived experience in research, that because our practice should be as diverse as the people we serve.
I think there is a valid area for public involvement with research because it can do two key things. It can both ground the research and also it can enrich and enhance it. It can redirect it when it's going slightly awry. It can inform it. And at the end of the day, the important thing, not the only, but the key thing is the outcome, tangible, demonstrable outcomes from research. And I think the public voice is so important in that. But the other reason is I believe there is a moral area where it's using public health data, public health information, and it's for the public. So I think they have a right to be involved and to contribute. And there's a return on that as well, because not only are the activities that I and other public advisors do, in other words, the activities, the range of things we do for mental health researchers, but also it reinforces by being able to know that we are giving something back, we are able to give something of value, that it really does help us on our side to feel that we are valued, we are listened to, and that we are worth listening to.
I've been a patient on the ward, so I've suffered with depression and anxiety, and I got myself well, and I like to give back. So I like to be there to help other people, to show them that, you don't always have to be stuck in depression. There's ways and means to get out of it. I get so much out of it and I say it all the time, but it's like cliche. If I could just help one person, then my mission's complete.
What I get back from supporting the work of the mission is the satisfaction of knowing that I am improving things for other people, that I am giving back to society. I think, in my way, research is what I give back for being here.
But also by being involved, it means that the whole activity of the research and then the outcome that comes out at the end can be done with the public, alongside the public, all together to achieve a common good, rather than healthcare being done to the public, which is sadly what happens in some circumstances. And it's quite depressing when one is involved with an organisation and you are able to discern quite swiftly that ultimately it's just a tick box. And it's a case of, yes, we're talking to you, we're telling you things. This is co-production, but it's not. Co-production as an activity guarantees, I would suggest, a better outcome that helps and transforms society, because we need the best quality healthcare that is possible.
I think that's really important, that my voice is heard and that people understand that what we feel might be different than what the academic feels, because we've lived it, and a lot of the things that they do, they haven't lived.
So I'm on work package 2, which is the digital twin, the AI avatar. Now, if I would have had that when I had a breakdown 20 years ago, that would have made so much of a difference for me. It'd have been more helpful. It'd have maybe helped me out of my depression a bit sooner than what took me to get out of it. The researchers and the developers, they've listened to everything. So everything that's happening now, it's all co-produced. Like, we are a real strong team. And like I was saying, there's like 42 of us on a service user carer representative and PPIE. And we've got 42 different lived experiences and 42 different ways of coming out of our depression or whatever has kept us afloat,
I have the privilege, because my background as a researcher, so I act as a co-applicant for some research funding within AMRIC and other wider partnership organizations. As a role as a service user, I saw the material like written from a researcher's perspective so I can contribute as my perspective as a service user. But my background as a researcher also equipped me well to the research application, so the dual identity really helpful for me to be involved in the mental health mission.
I think the mission's going to get experience from us for future patients to make things better in the future for other people.
I think the mission and the perception of where PPIE sits within their activities is fantastic, because what it does is it says we are on a journey and you are on that journey with us, and you are integral to what we are doing, and you are embedded within the actions that we take. And that's across the board, both in terms of not just helping with designing questionnaires, but in terms of questionnaires about what? About the actual research process itself. And there's a lot of training that's available as well, if it is appropriate, and if somebody wants to go down that path, to again work alongside the researchers and the academics. And quite often there will be ideas that come out from the public side which surprises and informs, I would suggest, some academics and researchers. And a number of times in the things that I've been doing, I've heard the phrase, well, we hadn't thought of that. And that, I think, is of immense value.